Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. June is Men's Health Month, and a major health issue for men is prostate cancer. It's a deadly disease, but early detection and treatment can mean the difference between life and death. Later in this program, we'll talk with someone who has a first-hand account of how his diagnosis saved his life, but we begin with Linda Kasebier. She's the Comprehensive Cancer Control Program Manager at IDPH. Linda, thank you for joining us.
Thanks for inviting me, Jim.
Well, to understand prostate cancer, I think it's important to first understand the prostate, what it is, where it's located, what function does it serve. Walk us through it.
Sure. So the prostate is part of the male reproductive system. It produces fluid that makes it part of semen. So the prostate is located just below the bladder and in front of the rectum, and it's about the size of a walnut, and it surrounds the urethra, the tube that empties urine from the bladder.
How common then is prostate cancer, and how does it manifest itself? What are the signs that someone might be suffering from this?
In Illinois in 2020, prostate cancer was the most common type of cancer in males, the second leading cause of deaths in male from cancer. And about 1 in 8 men will be diagnosed with prostate cancer during their lifetime. Different people have different symptoms for prostate cancer. Most men don't have any symptoms at all. So some of the symptoms can include difficulty starting urination, weak or interrupted flow of urine stream, urinating often, especially at night, trouble emptying the bladder completely, pain or burning during urination, blood or urine in the semen, pain in the back, hips, or pelvis that don't go away, or painful ejaculation. So if men have any of these symptoms, they need to see their doctor right away. But keep in mind that these symptoms may be caused by conditions other than prostate cancer.
And as you noted, some men may experience no symptoms at all, which means that being screened for prostate cancer becomes very important. How often should someone be routinely screened for prostate cancer?
The U.S. Preventative Services Task Force recommends men who are 55 to 69 years of age. They should make individual decisions about being screened for prostate cancer with a prostate-specific antigen test. And before deciding, men should talk to their doctor about the screening for prostate cancer, including the benefits and harms of tests and treatment. Men who are 70 years and older should not be screened for prostate cancer routinely. These recommendations apply to men who are at average risk or at an increased risk for prostate cancer, don't have symptoms, and have never been diagnosed with prostate cancer.
Do we have any statistics on whether most prostate cancers are detected through the course of the screenings, or is it usually found after someone has started to develop symptoms?
So the screening for prostate cancer is a blood test called a prostate-specific antigen, or PSA test. It measures the level of PSA in the blood, and the level of PSA in the blood can be higher for men who have prostate cancer, but it's also important to note that the PSA levels could also be elevated due to conditions other than cancer that affect the prostate.
Are there particular risk factors that might make someone more likely to contract prostate cancer?
Unfortunately, all men are at risk for prostate cancer, so anyone who has a prostate, including transgendered women and non-binary people assigned male at birth, can get prostate cancer. Out of every 100 men, about 13 will get prostate cancer during their lifetime, and about 2 to 3 men will die from prostate cancer. But some people are at increased risk for prostate cancer. African American men are more likely to get prostate cancer than other men. They're more than twice as likely to die from prostate cancer than other men. And they get prostate cancer at a younger age and tend to have more advanced disease when it's found. For some men, genetic factors can also put them at higher risk of prostate cancer. This includes individuals who have a first-degree relative, such as a father, son, or brother who had prostate cancer, and including relatives in 3 generations on their mother's or father's side of the family. They were diagnosed with prostate cancer at 55 years or younger, and they were diagnosed with prostate cancer in other members of their family who had been diagnosed with breast, ovarian, or pancreatic cancer. So it's very important for individuals to talk to their doctors about their family health history.
You've already mentioned some of the facts and figures on survival rates of prostate cancer here, but how does that vary based upon when the cancer is found? How important is early detection in terms of the survivability of prostate cancer?
Well, early detection is finding the cancer before it has spread. That's when cancer is most treatable. So the cancer stages, they're defined by cancer registries as localized, regional, distant, and unknown. So localized is when the cancer is limited to the place where it started with no sign that it spread. Regional is when the cancer is spread to nearby lymph nodes, tissues, or organs. Distant is when cancer has spread to distant parts of the body. And unknown is when there's not enough information to figure out the stage. So the 5-year survival rate for prostate cancer that is localized or regional is greater than 99%. However, when the prostate cancer is distant, meaning that it spread to distant parts of the body, the survival rate drops to 34%.
I'm guessing this is a sensitive issue for a lot of men. As you mentioned, this is part of the reproductive system, and that makes it perhaps even more difficult for men to confront these issues, to think about problems related to this. So how do we overcome that and really emphasize this importance of regular checkups, regular screenings?
All people should talk to their family to find out their family's health history. So if you have multiple relatives, siblings who have had cancer, unfortunately, it does increase your risk, but it's important to talk to your family to get that family history. And then most importantly, talk to your doctor. If you're noticing signs or symptoms, talk to your doctor immediately. And then if you're going in for other routine screenings, if your doctor doesn't bring it up, you should mention, ask your doctor about prostate cancer screening, and have that honest and open discussion, about if it's necessary for you to get, what are the risks, the harms, the benefits. It's just important to have that open conversation.
Good information for men, any man who's listening, and for anybody with an important man in your life to spread that word to them as well about this importance of regular checkups and screenings. Linda Kasebier, Comprehensive Cancer Control Program Manager of the Illinois Department of Public Health, joining us here on This is Public Health. Thank you, Linda, for your time. Joining us now on This is Public Health, Lester Adams, who has an important personal story to tell about the importance of prostate cancer screening. Mr. Adams, thank you so much for being here with us. I'd like to begin by asking you a question I wouldn't ordinarily ask, but I think it is important for this discussion. Tell me, sir, how old are you?
I am 30 days of being 103 years old. My birthday is July 3rd, 1921.
Absolutely remarkable, and even more so considering that you had been through a diagnosis of prostate cancer, and you are living proof of the importance of those cancer screenings. So tell me a bit about that moment in your life, and how was your prostate cancer discovered?
I was discovered to have prostate cancer in 1997. And at that time, it was a macho man thing because nobody wanted to talk about cancer within itself, and especially with men. I was dealing with the Veterans Administration at that time, and I was given an exam in 1997. It showed that I had a small image showing on my prostate. You remember at that time, they were doing the rectal test, and that's where it was found to be. And from there, I went to radiation. I had 37 units of radiation at that time. But going back to it in 1997, it was an unusual thing for men to even discuss prostate cancer. But I found out later in the years prostate cancer was a disease that could be detected early if men only paid attention, because they start to drift. When men start to drift, they ignore it. The large percentage of men, they just ignore it. But I had good medical attention, And I went on and I started, which they were giving lupin shot, to kill the hormone, went into the prostate treatment. I was very good in all my treatment. I did not miss a treatment, and it went well.
I want to hear a little bit more about leading up to your diagnosis.
After the diagnosis was completed, I was told that I had to go through the routine of treatment. And at that time, the VA was not doing cancer treatment on Damon. So I had Blue Cross Blue Shield and everything. So I went to the University of Chicago for the medical treatment. And that's why I did the 37 unit of radiation there. And then I went back to the Veterans Administration for follow-up. The follow-ups are very essential also because men have a problem with urinary tract infection, which need to be watched carefully because a urinary tract infection, in fact, I've had 2 of them, and they are painful when you can't pass your water. Twice in my lifetime, they have to inject a tube into your penis, and you are in pain. So that's why it is very essential that men have this treatment.
Now, had you had any symptoms prior to your cancer being discovered?
That was my good luck. They called it in a PSA exam, and we went from there. I never had no symptoms, no illness that I've had, in fact. When we get back to the kidney removal, I never had no problem with that. But we knew 25 years ago that I was going to have a defective kidney because they had been watching it for that period of time. And when it started to function around 10 or 20%, that's when we start paying attention. And then I become about the first 100-year-old man to have a kidney removed.
Another truly remarkable story and a great example of your resilience. How early was your cancer discovered, and what did that mean for your treatment and recovery?
Oh, it means everything to anyone because when we get around that macho man, we can start moving in the right direction because it makes no difference what disease that you have, you're not going to keep it a secret all your life. Somebody and everybody will eventually know that you had it. But that is one of the feelings that we want to keep to ourselves, and it just don't work.
Like you said, there's a sort of macho thing about maybe not seeing a doctor, not getting problems checked out, but you're living proof of why that's so important. What's your message to those men?
Well, it's hard to forget yesterday. That is a big problem that we have. We cannot remain the same state today that we were 20 years ago. So it says in my class motto, it's hard to say goodbye to yesterday. And life is just that way. We must learn to live together, peace and harmony, because at some time or another, something is going to happen that we need some help. Now, being near 103, you just stand and look back and wonder how you got over. I had 4 years, 5 months, and 4 days in the military. And that was a great education just to have the knowledge of other people's action in life, And I have found it, that if you want a good life, you have to start following the concept of treating your body like it's a kingdom.
Well, Mr. Adams, thank you so much for sharing your story. Congratulations to you on the great outcome, and we wish you continued good health and happiness as you get ready to celebrate your 103rd birthday. But again, you've done a real important service today in sharing your story with all the people listening here on the reminder of getting those checkups, getting screened. Lester Adams, thank you so much for joining us here on This is Public Health. Thanks to everyone for being here with us, and join us next time for another edition of This is Public Health with the Illinois Department of Public Health.